So I'm very excited about the Rise Up Phase 3 clinical trial results that were presented today. Rise Up was a global randomized placebo-controlled clinical trial examining the role of a new first-in-class treatment for people living with sickle cell disease. And today I gave the top-line results of a global clinical trial that enrolled over 200 individuals living with sickle cell disease all over the globe. So what I was able to share today was the result of two primary endpoints, one being hemoglobin response and one being the rate of sickle cell pain crises, or SCPCs, that people experience over the course of a year. And what we found is that there was a statistically significant increase in hemoglobin compared to placebo. 40.6% of patients responded compared to only 2.9% of those on placebo. What we found is that this was related to improvements in hemolytic anemia. One thing that's really important to highlight is the subgroup analysis of hemoglobin responders versus non-responders. And what we saw in that subgroup analysis is that hemoglobin responders actually had a reduction in sickle cell pain crises annually, as well as the sickle cell pain crises that require hospital visits or ER visits. It also reduced their length of hospital stay. It also improved their fatigue. And fatigue is one of the most important symptoms that individuals living with sickle cell disease struggle with. Also, compared to placebo, individuals who were randomized to receive Mitapivat were less likely to undergo transfusions during the 52-week study period and had a significant reduction in the number of blood transfusion units that they received. So this can be just so important, not only to how they feel, their degree of anemia, but also a reduction in pain crises as well as transfusion support. Also, what's really important to note is that the hemoglobin responder group had a 1.6 gram per deciliter increase in their average hemoglobin between weeks 24 and 52, which is amazing.